Good afternoon, everyone, and welcome to yet another amazing Real Talk show this Friday. On this today's topic is very interesting and is one of the most exciting events I'm looking forward to participating in this year. The road to the Regional Adolescent Health Indaba RAHi 2024. With me today on the show, I have Songiso, I have Lance, and Enoch, and our sign language interpreter Shadrach. Welcome, guys.
Thank
Thank
you
you.
very much.
So this is a very interesting topic. I'm very excited and I can't wait to attend the RAHi 2024. I hope to our online audience are equally as excited as I am for this year's show. So before we even dive deep into the discussion, would like to have a brief introduction on what is the main reason for behind hosting the RAHi 2024 event and what we hope to achieve through this platform. Mr. Toka, could you walk us through that?
Yeah, thank you so much, Linda. And thank you so much to those that have found time to join us. Yeah, so the Regional Adolescent Health Indaba comes from way back as 2018 when we started hosting national conferences. So we realized that in most of the programmings and services that were being provided in terms of adolescent health did not have the voice from adolescents. So you'd agree with me that from way past the years, programmers and even the health care provision system doesn't allow or doesn't permit, or there are no avenues for adolescents to participate. And so it's very difficult for them to be able to share strategies, experiences, and so forth. So RAHi, or Adolescent Health Indaba, it's that opportunity for adolescents and young people to be able to contribute to the discussion around their own health. So you'd agree with me if you have attended our past engagements that this is a unique initiative that allows young people or the adolescents to interface with people that are providing services, the people that come up with policies and laws that give a pathway for adolescents to be able to provide those particular services or to craft the laws that permit for services to be provided. So it's a platform unique for that matter for adolescents to interact with policymakers and service providers to add their voice to their own health delivery system. So, in a nutshell, that's the motivation around the RAHi, and also the reason why we have consistently uh, annually held the Regional Adolescent Health Indaba. Yeah.
That's so great to hear. Before I let you go, could you also please tell us can you highlight some of the notifiable outcomes and policies that have and changes that have come from the previous adolescent health Indaba events that have been held? What positive impact or outcomes have come from the previous activities in relation to adolescent health?
So, first of all, like I pointed out, the issue of adolescents being able to participate in their own health. You do see that there was the first time we used to hold it at national level, and we started holding the regional Indaba. Now there's also a provision for adolescents from the districts. For this year, for the first time, we are going to start from the districts. So that's a key change. Then we mean that young people, adolescents will be able to participate in the remote areas to contribute to their own health. Apart from that, we are going to also escalate the discussion to the provinces. So it means opportunities being given to the adolescents in their vicinity within the provinces for them to add a voice in shaping programs and shaping, policy in terms of adolescent health. But apart from that, you've been able to change, been able to contribute to change. We can't say really the RAHi has been alone being the agent for some of the changes that have been noticed. But the RAHi has been able to significantly contribute to that particular change. One of the notable changes is that the Minister of Health, I think, for some time has been contemplating and in a small way been able to take healthcare providers, in terms of sign language, basic sign language skills. So you find some of the facilities around the country have now healthcare providers that have been trained in basic sign language, which was a challenge before, because healthcare workers had challenges in discussing or just providing services to young people with disabilities, especially the deaf and so forth. For the first time, I think we have been able to see a conversation and some notable moves in that particular regard. Some of the infrastructure, you agree with me, around the country, both private and public health institutions didn't have provisions for young people with physical disabilities to be able to, to access some of those. And also, generally, we have seen an improvement in terms of adolescent health. You know that the mainstream health care provision didn't have provision for adolescent health. I think now it's a topic for every other establishment at every level of Ministry of Health. You are going to find specific people that are trained in adolescent health, be it at provincial, national level, district, facility level, at all levels. So those are some of the changes. But I think above all, we have been able to see improvement in terms of engagement of adolescents in all discussions, be it at technical working group level, be it at facility level. I think is even the improvement in terms of how adolescent health provision is being done. Before now, we had the youth-friendly corners. Now we have youth-friendly spaces. That is a huge improvement because now we don't have specific corners because those are the stigma attached. But now we have spaces, and now we are even transitioning into advocating for what is called youth-friendly health, system, whereby everyone is youth-friendly around the health facilities. So those are some of the key changes that we've been able to see over time, and we hope to see more changes and the health establishment that is adolescent-friendly. Yeah.
That's great. So while we are still talking about the
Linda
our
is good. Yes, Linda, you're back.
Oh, I was gone for a second. The network is bad. I apologize for that. So, while we are still on previous RAHi events, we have with us on the show today Songiso, who was awarded for one of the winners of the Adolescent Health Hero Awards. So, we have seen the traffic that has been going on. I hope our online audience has you've sent through your nominees and everyone else for those awards. So, Songiso, could you just please share with us your personal experience with participating in the Health Hero Award and how significant it was for you? And yeah, could you tell us about your experience with the Health Hero Award?
Wow, that was a great opportunity I had right there. Because when I people started nominating, I couldn't even believe it at the first time. But then people saw this vision in me, and they even identified me from the provincial level, whereby they even nominated me to be one of the 66 nominated candidates for last year. So this experience, I don't know how I can put it in words, but it was really amazing. Coming to the RAHi itself in Lusaka, it was very great. I met new friends, new networks, other adolescents from these other countries. Let's say for Mazimbo Manyama, the people from Zimbabwe who were also powerful for this RAHi. So all this contributed, and I would also like to thank all the people who nominated for me last year. And it was really a great honor to even receive the award from the Minister of Health herself, Masebo. So Sylvia Masebo. So it was really great. Yeah, it was. I think how I wish the moment can repeat because it was really great being around other young people. Sure.
That's really great to hear. I'm sure you're overwhelmed with the emotions and everything else. So could you also tell us how the Health Hero, being one of the winners for the Health Hero Awards, has impacted your career, your works, and everything else?
Well, to start off, I really got recognition from my province, which is Western. Yeah, so I've been put in other program and projects that to do with adolescents. And to mention, last year we also had an event under adaptive leadership, which was the That One Is You. So I got an opportunity to host that event, and other organizations started coming in. For example, Siders. Yes, I also had an opportunity to work with Siders in the project. Also, Dreams in the Foundation for Adolescent Girls and Young People in Zambia. So these are only health NGOs that have engaged me with their programs. So to leave out these other organizations which deal with other stuff. But in health wise, yeah, I got many opportunities. And even now, there's still some programs that I'm still doing out of the award that I received. Yeah, and my experience with this award, it was really great. Yeah, to mention the trip to Livingston, which comes with this award, it was really amazing. Can't wait to see the documentary, the full documentary of that journey. Actually, I still have pictures that I haven't yet posted because it was really amazing. It was just great. So this is an award. It's a really great award because people are being identified of what they're doing. Sure.
So we have talked about what the RAHi is about. We've come to understand what impactful policies the RAHi has had. We've had a glimpse about the Health Heroes Award. Now I want us to talk about something that's really great, and that's the Regional Adolescent Health Indaba Magazine 2023. So Lance, could you explain what the Regional Adolescent Health Indaba Magazine is and how it fits into the broader RAHi initiative?
Okay, thank you very much once more again. So just to answer that question, I would have loved maybe to take it back, like to define what the magazine is, but none other than less and must talk about what the RAHi magazine is. So the RAHi magazine, this is a magazine, it's more like a yearbook that is just meant to like document the events that take place in every year during the Indabas. Like so far, we have done the first edition, which was for 2022, that was released in 2023. So maybe just to mention and ensure that it is understood clear. So this magazine is done in partnership, with PP Media Impact. And when we talk about PP Media Impact, this is an organization that uses media as a key for social change. So PP Media has partnered, okay. Have I answered that question, the first one? So now the second thing also about the magazine, which you have just said. So I'm a little bit nervous, you forgive me. It's the first time, yeah. So the second thing on the magazine, which you spoke about, how it fits into the broader perspective of the initiative of RAHi, is that this magazine, it has been there to stipulate the general objectives of the RAHi every year. It has spoken about a lot of things, a lot of topics. I would have loved to mention the topics. And it also focuses on the expectations of the youth out there. And it also focuses also on the outcomes. Thank you very much.
All right. So before I let you go, how can people, our online audience, be able to access this magazine? Is it available on both digital or is just printed forms? And how can individuals access the RAHi magazine?
Okay. So the magazine is both. It's going to be printed out as a hard copy. Also, it's going to be a digital document. I think the leadership will be able to share much on that.
All right, great. I'm sure PP Media has done a very great job with that magazine, huh? So now we are going to move on and go and talk to our partners. So to our online audience, you can send through your questions that you have around the event, and all those other questions and your concerns about the Regional Adolescent Health Indaba 2024. And our team here is gonna address those various questions. So for those partners, individuals that want to, like private organizations, partners and individuals that are interested in supporting the RAHi 2024, what opportunities are available for them to get involved with and to contribute? Mr. Toka, could you walk us through that?
Yeah, thank you so much. So first of all, the road to participation is very transparent and as can be obtained from our social media platforms, including on our website, Facebook, and other platforms. So the advert that has been pushed for the RAHi that will be held between 12th and 14th June participants are supposed to use. So that link takes you on to a form where they're supposed to indicate their expression or show their expression to attend the RAHi. And you know that the RAHi is an event that happens and opens opportunities for adolescents across the region. So we have overwhelmed the number of people that we apply each year. So there's a piece within the application form which gives the leverage for the applicants to be able to tell us more about themselves and really show cause why we should be able to pick them. So that's why we encourage the applicants to be able to pay much attention because it's there where you're marketing yourself, why we should be able to pick you. But I think by and large, we prioritize TYP members. As you know, TYP is a network which affiliates individual members, organizations that are also dealing with adolescent and youth work. So those are our priorities. And also when you go to our website, there's a provision or a link that takes you to membership. So we would encourage the applicants or prospect participants to first of all ensure that they are members. You do the registration form. Once you're admitted as a member, now you can do the application to attend the RAHi. So there are a lot of opportunities that lie in you being part of the discussion. One opportunity is networking. I know that for adolescents and young people, it's difficult for you to really see the value of networking, but I think networking helps in a lot of spheres. For those that are in colleges, this is an opportunity for you to interface with other young people and adolescents that are aiming to do different things in terms of the school. So you can network. For those that are in programming within our adolescent space, you can also network to tap on the strategies, skills, and also some of the innovations that your colleagues are doing in different locations within the country and within the region. For partners, we have also another level of participation where partners can interface with us, express interest in terms of how many numbers of adolescents they want to attend from their countries, from their provinces, from their districts. There's also that slot, as you can see, or as you could read from the magazine. Those partners that we have worked with have been able to bring to the table not only resources but also participants that they have been able to pay for. But also there's a window for experts that would want to come and present or share their research in terms of adolescent work with adolescents and they speak to adolescents academias and other research institutions. They are also welcome. There are also private sector. You know that the RAHi brings quite a number of participants, up to 500 plus. So for private sector, that's an opportunity for marketing. So we are calling for telecommunication companies, the banks, and indeed any other business that may be interested to be able to come. That's an opportunity for them to come and be part of that. Saying that, I want to salute Gawa Clinic. Yeah, I think they have been consistent from the time we started with the national conference, now regional conference that we are holding. They have been part of that particular journey in terms of not only providing on-site services, but that particular partnership. and so many others that I cannot be able to mention. So, yes, in answering your question, this is a wonderful opportunity not only to come and discuss health, but also to come and be part of the hero, just like Songiso, champions of ensuring that we work together to improve, the adolescent health, quality of adolescent health in Zambia, because they say the young people today are the future leaders tomorrow. And now themselves are redefining this. They're saying, we are leaders today. Why we are leaders today is because if your today health is not taken seriously or you are ill today, you are not going to be a leader tomorrow. So that's why you have to come as a partner and be part of these champions that are championing, the health of adolescents. So there's opportunity, Linda, for everyone that wants to come and participate, either from health point of view or business sense part of it. I think there's just opportunity for everyone. And there's that particular avenue that I've talked about. On Facebook, there are all the links that you require for you to register, either as a member, as a participant, or as anybody that is coming to participate in the way of, carrying out a session or publishing or sharing research. So you can do that on our Facebook page. You're going to find the link, or the link that will take you to our website. You'll be able to find all these particular opportunities for registration to participate. Yeah.
To our online audience, if I was you, I would have been already going to look for that link and registering to be a TYP member, because it's gonna open great opportunities for you. Just not being accepted, just not the whole procedure of attending the RAHi, but there's a lot of great things that come from being part of the largest youth adolescent health youth network in the country. So in our comments section, we have a question. So Chabu Nyumba says, what about those who are blind, and how can they access the magazine? Lance, could you answer that for us?
Okay. So I was also on the comment side. I'm saying someone saying the question is hard. Okay, but I think one of the things that RAHi is focusing on is inclusiveness. That's one of the things that I saw in the magazine. So when you talk about inclusiveness, it means that everyone has to be involved, everyone has to be reached. So it's not yet in plan yet, but I believe we're working on it to create a magazine that is going to also be inclusive of everyone. We're not just going to focus maybe on just the blind people, but also maybe we need a magazine that's going to also be in audio, just to to help those people maybe that can't hear also. So am I right if I yeah.
Yeah, so
Just
in
to help
terms
those
of
people that
participation, just to add on to what Lance has said, in terms of participation, there's a special consideration that we put in place to make sure that we deliberately put steps that will ensure that young people with disabilities also can be able to participate. So as I said, we are a network of youth organizations, and also we affiliate organizations that work with different categories of young people. So those are usually gotten through that particular network. So deliberate to target some of those from that constituency and ensure that through their leaders they are elected or picked or selected to be able to come and attend. And you attest to the fact that each year we do have young people that are trying attending the RAHi, and indeed that are living with different disabilities. Yeah.
Okay, great. So while I'm still with you, Mr. Toka, could you please just tell us why it is essential to recognize adolescent health heroes, and how do they contribute to the improvement of healthcare delivery for young people?
Yeah, so that's very important. For a long time now, we feel people take it for granted that the health workers, it's their job. After all, they're getting paid for it and so forth. But I think even when you check the narrative around at national level, it has been changed because for the first time we saw government actually even recognizing those that were doing voluntary work and gave them a job. That is a form of recognition that health workers go a step further in terms of ensuring they provide a service. And for us, we made a provision for recognizing and awarding and motivating these particular health heroes because we know in the provision of services, there are those that will do it because it's their job. There are those that will do it with passion. There are those that will do it because they have to get paid. But there are those that are standing that will go an extra mile to be able to make sure that they provide extreme services. And those are the target for this particular award. So, what does this award do? Songis has already told you that is overjoyed and is also more encouraged, after that particular award. So for us, it's a form of ensuring that a health worker is appreciated. And when the health worker is appreciated, we know that they are going to do more because it's not only about the money, it's not about a job, but it's about going an extra mile to make sure that you save that particular life, you provide that service with passion. So for us, it's motivation, but also to give a sense to this provider why they should stay on the job and do what they do so that they can also enjoy what they do. And we are yet to do an assessment of the health heroes that we've been able to award to see how we were able to award them. And I have no doubt that we are going to receive positive feedback from there. So we want to encourage through this particular question you have asked, Linda, for a lot of health workers across the country that please do your best because what you do, you are saving a life. You are actually giving that opportunity for that adolescent to achieve their goals because they are in the state of well-being and so forth. And who knows, through this particular opening, you may be that health hero that is going to be picked. This time around, you may not only go to Livingston, but maybe you go to Dubai. Who knows, Linda? Yeah.
Hey, can you
Yeah.
please nominate me to be healthier? I think I want to go to Dubai. It's not to let
We
me
are
bring
not
my
yet
career.
we are not preempting the destination, so you never know.
Because
Yeah.
while on that, I think I should change my career. I need to be nominated. I might stand a chance to go to Dubai. So while we are
Yeah.
still on this, Songiso, so are you running again in the game? Are you expecting to be nominated again? Do you want to try again and see if you're gonna win again?
Ah, it would be good, of course, to be nominated again. I've just did the Dubai journey there.
So,
Otherwise, you never know. You never know what. It's the people who are choosing. Yeah, but otherwise, I would just like to
yeah.
encourage the audience there to nominate these health workers. They really deserve it. I mean, their work has to be identified by a big number of people. What they're doing is very important because as an adolescent and as young people, we tend to make wrong choices as early as 16, 17. So we need these life coaches, people to guide us, to show us the way that, like, look, you're supposed to head this direction. So these people, we really need them, and they can only be boosted or motivated if they're being nominated as health heroes. So what are you still waiting for? Let's keep on nominating these people because they really deserve it. Sure.
I hope you're nominating someone yourself. That's not
Yeah.
you.
How I wish you can nominate yourself, but yeah, there are people in
But you
mind
can
I
still
have.
send through that nomination for someone else,
Yeah,
yeah?
yeah, sure. Actually, I have one in mind where I'm currently at, the facility, which is Mungu District Hospital. I won't mention the name though, but the title, the focal point person. Yeah, well, I mean, these focal point persons who deal with adolescents, they are one of those health workers dedicated in helping adolescents, because when it was first introduced into facilities, the friendly spaces, adolescent health friendly space, it was given to these focal point persons. So I think they really deserve it. So I
All
have
right,
that
that is
focal
great.
point. I'm going to nominate that person. Sure.
All right, so to our online audience, I encourage you to look for the link on I'm sure it was posted on the Facebook page, so that you can send through your nominations for who is your adolescent health hero. So as we wrap up the show, Mr. Ntoka, could you tell us what are some of the key takeaways that you would like the audience to remember in today's show about the road to RAHi, and also those interested in getting involved?
Yeah, so I think I'll emphasize the fact that the applications to attend the 2024 RAHi are open, and those particular links can be obtained from our Facebook page and also from our website. Yeah, so the Facebook page link and indeed any other links have been posted on this particular chat, so you can simply tap on there and be able to register. But I think remember, priority is being given to our members, so ensure also to register as a member, and it will not take more than a day. We'll be able to assess your application and admit you, and you are going to be given a notification that now you're a member and so forth. Yeah, so I think that is important, but also it's important for you to participate in the Health Hero, because the more we recognize the health care workers, the more our services are going to improve. Who knows, maybe the reason why we still have challenges in adolescent health and services is because we are not taking a proactive step as adolescents in ensuring that we recognize those that are putting in their all to ensure that the services are available. So let's participate in there. It's very much important. So we hope to see a number of you that will be nominated and voted for being awarded. We are not going to say what we are giving you this time around, because we want to keep it the surprise and to continue to encourage you to participate in this particular race. So I think that for me is the takeaway. And just to encourage the ask of that question around the young people that are blind, that we are going to really find a way to make sure that young people with the physical disabilities are part of the RAHi, has always been. Thank you for this platform, Linda. Yeah, and thank you to everybody that tuned up and that tuned into this particular show.
All right, thank you so much. So please keep an eye, because the RAHi magazine is out next week. I hope all of you are looking forward to reading through the content just like I am, and also send through your nominations. And I cannot emphasize this enough. Let's apply to attend the Regional Adolescent Health Indaba for the year 2024. But trust me, it's gonna be bigger and better, and you don't wanna miss the event. Thank you so much for joining us on today's show. Thank you so much to my guests. It was great having you on the show. See you next week.